Aspirin and surgery. Well, here would depend. In case of elective surgery, it's as warfarin, stop it 5 days before the surgery. And in case of emergency surgery, give the patient platelet immediately and proceed to the surgery because aspirin is antiplatelet, not anticoagulant. So give the patient platelet. Heparin induced thrombocytopenia. It's very important. Here, the heparin itself will cause thrombocytopenia sometimes. The pathophysiology here is heparin, sometimes it will lead to formation of autoantibodies. And this will lead to activation of the platelets and lead to thrombosis. So, this overall will lead to thrombocytopenia. So the keyword here will be patient taking warfarin and the platelet count is very low, so there is thrombocytopenia and there is signs of thrombosis. That's mean heparin induced thrombocytopenia. The treatment here is very important. Stop the heparin immediately and send the patient for plasmapheresis immediately. The idea here is plasmapheresis will remove these autoantibodies from the blood. And remember, never give the patient platelets because it will make the condition worse. Never ever give the patient platelets because it will lead to more thrombosis and more complications. Now, what if the patient is highly indicated for heparin? I mean, he's highly indicated for anticoagulant. What is the replacement for heparin? Here, give the patient direct thrombin inhibitor if the patient develop heparin-induced thrombocytopenia. Okay? Warfarin-induced thrombosis. It's strange. So the warfarin will cause a thrombosis. How is that happened? Here is the pathophysiology. The liver will produce two things: coagulation factors and also protein C and S. Coagulation factors will cause coagulation, and protein C and S counteract the effect of coagulation factors. So, the half-life of coagulation factors is around 4 to 5 days in the circulation, while protein C and S will remain in the circulation around 24 hours. So, if we give the patient warfarin, warfarin will stop both pathways. I mean, it will stop production of coagulation factors and also stop the production of protein C and S. That's mean from day 2 to day 5, the coagulation factors will remain in the circulation while protein C and S were removed from the circulation because their half-life is around just 24 hours. So there is a risk of thrombosis during this time because there is no counter effect of these coagulation factors. And this will lead to warfarin-induced thrombosis. This is as simple as it is. So when it will happen, it usually happened around day 3 to day 4 of starting of warfarin therapy. It usually involves breast, thigh, and abdomen, but it can involve any area of the body. So how to deal with that? The treatment will be stopping warfarin immediately and giving the patient low molecular weight heparin as soon as possible. Well, heparin here will abort the work of all coagulation factors in the circulation. So heparin working by stop the effect of these coagulation factors in the blood, while warfarin, the work of it is stop the production of coagulation factors from the liver. So warfarin will take long time, while heparin will act immediately on the circulation level, I mean. For the prevention is simply by giving the patient warfarin and heparin at the same time on day 1 of starting of the therapy, because heparin will stop the coagulation factors at the circulation level, while warfarin will stop the production. For full course, please contact us through amcqbook@gmail.com. Thanks and goodbye.